weird about both of our journeys. At one point, somebody said to both of us, "You look like a nurse."
Yeah.
Because my aunt said that to me when I went back to nursing school. Like, of course you're doing that, Kristin. You've always looked like a nurse. And then somebody said that to you.
I know. It was at my very first day of orientation to nursing school. And I was so nervous just walking in there. I was like, I don't even know if I belong here. And the lady sitting behind the table was like, "You look like a nurse." I thought, what an odd thing to say. What do nurses look like?
Is that a nice way of people saying you're not wearing much makeup? And you like comfortable clothing? Although maybe that's just a way of saying I can see qualities in you that'd be good at that.
I can see your kindness and your comfortable shoes. So between us, we've taken care of thousands of critically ill patients.
Yeah.
Right?
Right.
What do they all have in common?
It's universal that people are scared about their health. Even when we take care of doctors and other nurses, we can't talk to them differently than we do our patients with no healthcare background because the fear of being critically ill just wipes out that common sense and that knowledge that you have. So everyone's afraid, and I would argue, when you're afraid in the hospital, the person you need is the nurse. They look to their nurse to know what to do and how to feel about it and how to process it. No matter if you're the millionaire or if you're the guy in the park, I think that's really universal.
Caring for the patient physically, emotionally, you're caring for their families
Right.
who are having their worst day.
Yeah.
But you're right there with them, and in the back of your mind, you're keeping your eye on their drip rates, and you're keeping an eye on their vitals, and you're keeping an eye on their lab work, and you're thinking always 2 steps ahead of what's going on next while you hold it all together and tell them everything's going to be fine, and here's what's to expect next. In what other profession are you so immediately intimate
Yes.
with strangers?
All the layers of intimacy.
Yeah.
We are physically intimate with people immediately.
Yeah, like I'm going to clean you.
I'm going to wipe your bum now.
Sure.
Roll over.
But also, I'm going to know what you're afraid of.
Nurses are really good therapists at listening and providing feedback and saying, "I think what I hear you say is this. Do you want to tell me that again?" Or, "I see you're really anxious. Do you want to talk about that?" It's a huge part of our day.
It's true.
Yeah.
Maybe we can restore you back to your original health, or maybe
Sometimes.
you're going to have to be really adjusting to a new normal. And what is that going to look like? Or there are those patients who are dying, and how can we make this as peaceful a process as possible?
It's such a gift of a job. It's really, really physically hard, and it's draining for sure, but I don't know if there's any work more meaningful.